The federal government has been planning vaccine distribution since at least the 2009 H1N1 flu pandemic. Based on that experience, the CDC came up with a vaccine prioritization plan for COVID 19 that broke vaccination up into three phases, corresponding to the availability chart we discussed in the last episode. Phase 1A would be focused on healthcare workers. Phase 1B would include essential workers who could not socially distance, those over 65, and those 16 to 64 at highest risk. Phase 2 would include essential workers and those from 16 to 64 at higher risk. And finally, Phase 3 would basically be everyone else. The ACIP modified this approach, adding a new Phase 1C. In early December, it recommended that Phase 1A include healthcare personnel and those living and working at long-term care facilities. At that time, it indicated that Phase 1B would include essential workers and Phase 1C would comprise adults over 65 as well as those from 16 to 64 at high risk. However, weeks later, when issuing recommendations for Phase 1B, the ACIP further modified its prioritization recommendations. It created a new frontline essential workers classification and subdivided out those over 75 from adults 65 and older. Notably, it switched those two new categories, essentially prioritizing adults 75 and older over those essential workers deemed to be not on the front lines. The ACIP defined frontline essential workers as workers who are in sectors essential to the functioning of society and who are at substantially higher risk of exposure to SARS-CoV-2. The category was determined to include jobs like first responders, teachers, and grocery store workers, while essential workers included critical infrastructure workers, food service workers, and attorneys. Personally, I think excluding certain workers from the critical infrastructure sector may have been an oversight. Full disclosure, I represent clients in this area, so I'm biased. But I still think a strong argument can be made that at least a subset of employees in such companies, like operations room workers or linemen, who are critical to reliable operation but cannot work from home, should be prioritized. Ultimately, it falls on these companies to advocate for their local leaders to use authority over state implementation plans to address this issue. Finally, otherwise healthy individuals 16 to 64 would comprise Phase 2, while Phase 3 would administer vaccines freely to anyone who hadn't received one yet. One may look at this chart and ask, what about children under 16? The problem is we don't have data on the vaccine's effect on children. In fact, Moderna just announced that we may not get that data until 2022. So at this time, it is unclear where children would be prioritized. Hopefully we'll get more answers soon.